We acknowledge that Indigenous communities, which often exist on both sides of the Canada-U.S. border.
Tonight, the Canada-U.S. border closes to non-essential travel at midnight. How will it affect First Nations?
Put in 33 families on a market simultaneously with less than 1% is just, it's an absolute disaster.
And the fight against reno-victions in northern BC. Good evening, welcome to APTN National News. I'm Dennis Ward. Today, the Prime Minister ramped up on efforts to flatten the curve. He announced the new strategy that will make it easier for companies to provide materials to fight COVID-19. APTN's Todd Lamarand has more.
Trudeau announced the new action in his daily briefing. It'll allow businesses to develop solutions and make supplies Canadians need.
This initiative will help companies that are already making things like masks, ventilators, and hand sanitizer to massively scale up production. It will also provide support to those who want to retool their manufacturing facilities to contribute to this fight.
However, Trudeau skirted the question of whether Canada will undergo a massive shutdown, similar to ones in California and Europe.
We are looking at all possible different measures. As I've said repeatedly, nothing is off the table, but we will continue to announce measures as they become necessary.
The COVID Cabinet Committee members were asked why everyone who shows symptoms is not being tested for the virus. Dr. Theresa Tam said people who live in certain communities have a more specific need and will be tested.
Such as people who are living in the north, or people who live in certain First Nations, Inuit or Métis communities, where you absolutely want to be certain that they're not being impacted by the virus or that you need to contain it really, really fast.
Public Safety and Emergency Preparedness Minister Bill Blair insisted that non-essential travel at the border will stop at midnight tonight for at least 30 days, but did make this qualification.
We acknowledge that Indigenous communities, which often exist on both sides of the Canada-U.S. border. I want to offer them reassurance that we recognize and acknowledge their right to travel and that it is essential, and it will continue unimpeded during this restriction.
Minister Blair's office did not clarify by airtime whether the exemption was for all First Nations people or just those communities that straddle the border. Todd Lamarand, APTN National News, Ottawa.
This week saw provinces, territories, and Indigenous communities call states of emergency. The World Health Organization has documented nearly 210,000 cases globally, with approximately 900 of those being in Canada as of Friday morning. 2 Indigenous communities reported confirmed cases, one in Saskatchewan, one in Quebec. Here's Brittany Hobson with more.
The Manitoba government declared a state of emergency Friday morning. They follow the rest of the provinces and territories who sounded the alarm this week.
We must continue to use every tool we have in our possible availability to flatten the curve here and to do our part to protect all Manitobans. The measures that we're taking today will enshrine, quite frankly, what has already been happening in Manitoba. Indigenous nations and organizations are also declaring states of emergencies.
We just don't know how bad it is. If we look at what we're seeing around the world, especially in Italy, we see a G7 country that wasn't prepared. And we do not want to see the same thing in Canada. Grand Chief Jerry Daniels of the Southern Chiefs Organization in Manitoba spoke out about the urgent need for medical supplies in First Nations. The federal government heard those calls and allocated $305 million to Indigenous communities as part of an $82 billion response package.
We are going to be sending money to Indigenous communities for them to use the way they need to keep their communities safe through COVID-19 and support access to supplies they need and get through this difficult situation.
However, few details have been released on how the money will be distributed. As of 9 a.m. March 20th, there was a total of 873 confirmed and presumptive cases in Canada. For the first time, cases of the virus were reported in First Nations this week. One in Ganawage.
I'm here today to advise the community that we had a first positive case of COVID-19 in the community.
another confirmed and one presumptive in South End, a community in northern Saskatchewan. Indigenous leadership continued to take preventative measures. Many started implementing border closures. At a press conference Wednesday, Dr. Barry LaValle said now is the time to rely on traditional practices.
If you have trap lines, hunting areas, we're asking communities to go out for rest periods of a week or more.
Brittany Hobson, APTN National News.
The Manitoba Métis Federation will be providing $1 million to help Métis elders, entrepreneurs, and employees affected by COVID-19. Some of the money will be used to help people that have been laid off or have been forced to shut down. The Federation says over 1,000 elders have already been contacted to ensure they have rides for appointments, medication, and food. The MMF also purchased 3 mobile health isolation units that can be used anywhere in the province. Manitoba Métis President David Chartrand says Métis communities will start seeing the money immediately. Well, a $300 million package has been announced by the federal government for Indigenous peoples. We'll try to get a better handle on what that means when we sit down with the Minister of Indigenous Services after the break. Here's a look at Saturday's weather forecast. Starting on the East Coast, +7 with showers for St. John's, -7 for Charlottetown, 4 below with snow for Happy Valley Goose Bay, -1 in Cartwright, -1 as well for Montreal, 10 below in Chibougamau and Saguenay, 0 in Peterborough, -2 under sunny skies in Ottawa, -2 for Wawa, Thunder Bay, and Sioux Lookout, -6 in Churchill, 9 below for Norway House, a sunny day and 6 below for Winnipeg and Gimli, -7 in Brandon, 1 below with rain for Regina, -2 under sunny skies in Saskatoon, 4 below in Uranium City and Stony Rapids. Welcome back. It's a question of when, not if, COVID-19 gets into Indigenous communities. So said Indigenous Services Minister Mark Miller on Thursday as he attended his first COVID Cabinet Committee press conference in Ottawa. Miller announced $305 million to prepare Indigenous communities for the coming crisis. He joins us now. Minister Miller, thanks for joining us. What are some of the specific things Indigenous communities can use the $305 million fund for?
Well, first, thanks, Dennis, for having me on. And I'm here from Skype practicing social distancing, as we all should be doing during this period. I'd love to be in studio, but unfortunately, we all have to be responsible and stay away from each other, frankly, during this period that's going to last a long time. Mm-hmm. Look, obviously what we've heard from communities is to have, and nations, to have the maximum amount of flexibility in the way they use their funds to flatten that curve, which is a very, very serious global pandemic. And so what I've instructed my team to do at Indigenous Services Canada, and what we are looking at, is a rapid deployment of funds into communities as quickly as possible, so that there is maximum amount of flexibility in using those funds to prepare, plan, get the very important public health message out to stay at home, self-isolate, look for symptoms, and to practice that basic hygiene that is so key every year during the flu season, but is even more important now. And so, conscious that there is and will be a vote on this, my team is working hard on working at those allocations for communities to know, so that they know that they have the backing of the Government of Canada in the amounts that will allow them to plan and purchase material to plan for this.
So we've known about the virus for weeks. Why so long to respond, and how will the funds be allocated?
Well, so Dennis, the most important thing that has been going on over the last few weeks is to have teams in contact with local health leadership, whether that's elected council or other, to ensure that the very, very basic message to practice self-isolation, social distancing, good, proper hygiene, in tandem with the very important pandemic plans that are in place in communities are respected. This is proven science to flatten that curve that will limit the impact on the health system. As we've been clear, this isn't a question of if, it is a question of when. In tandem with that, obviously, is the important discussion, particularly Indigenous communities, about availability of resources with respect to a healthcare system that they've been underserved by historically. And so that is a message that we've heard loud and clear. The announcement by the Prime Minister was 2 days ago. And so our action at the Government of Canada has been solely focused on ensuring that those funds are deployed so that there's a maximum amount of flexibility on a distinctions-based scenario in communities, and that includes Inuit, Métis, First Nations, self-governing, and modern treaty.
Right, but so how will the funds be allocated? Is it going to be based on needs, urgency?
Well, let me be clear about this. This is the beginning of a conversation in terms of financial, in terms of physical resources. We know from our lessons from H1N1 that Indigenous communities are not only disproportionately affected, but it can vary from region to region. So as you trace the course of this pandemic, you have to plan for a number of things. One, the immediate need and sanitary hygienic resources that communities need, and need the financial backing of the Government of Canada to ensure that they are not out of pocket. And that's what we are moving to do. There is also amounts that are set aside to plan for surge capacity, whether that's personal protective equipment, testing kits, movable units that can be deployed in a very rapid fashion to address any surge that we may see. Luckily, that has not occurred yet, but it doesn't mean that we're not planning for it. So you have to look at this in a number of elements, and this is not something that is going to go away in 2 weeks. People need to be very, very conscious of the fact that this could last a very, very long time, and part of the epidemiological planning of this is to flatten this so-called curve so there's no impact on the health system. But that also means a longer onset of the pandemic, but then the healthcare system can move in and help and frankly keep people healthy and stay alive.
So yesterday you said if Indigenous leaders have any concerns to contact your team directly. What do you do if a call comes in and an isolated community is feeling fearful and overwhelmed?
Well, again, the remote communities face a number of risks on a daily basis, and faced in a pandemic, that just creates not only exponential fear, but exponential risk. And so our teams, whether that's regional offices, whether that is planning and support from various levels of the government that are engaged in this, stand ready to help. We faced unique challenges with flying communities. There are 96 First Nation communities that are fly-in in nature. There are 51 Inuit communities that face a similar situation. So they may have accrued needs that we will respond quite quickly on when we hear it. There are various decisions being made across the country as to self-isolation, which comports risk. But as we are doing and as we have done over the last month or so, we've been engaged with health leadership, whether that's nurses or doctors or health authorities in the communities, to make sure the protocols are being observed. And I would encourage anyone listening to this to observe those protocols, because they are demonstrated by science to reduce that curve, but also ensure that the resources are in place and the capacity is in place in the event of a surge need and the surge capacity that is required in the community.
As you know, we're about to come up on a time that's the annual spring flooding. What help will communities have to evacuate if that's the case?
Well, in the face of the pandemic, there are a bunch of unique challenges, and the risk obviously is accrued. There are some communities that face geographical challenges. They may sit on wetlands, and a number of them have declared states of emergencies. That will require resources that are over and above those we would use for pandemic planning. And obviously, we have to be sensitive to the fact that in situations of overcrowding, the risk of propagation is greater. So we're very, very sensitive to this. I've received letters from chiefs and tribal councils to that effect, and our department stands ready to deploy the resources that are needed based on additional risks, among which are flooding challenges.
Well, Minister, a lot of questions still out there. We do appreciate you taking some time for us here today, though.
Well, thank you for having me on.
Still to come, why dozens of people are being evicted from their homes in northern British Columbia. Here's a look at the rest of Saturday's weather forecast, picking back up in northern Alberta. +3 with snow in Peace River and high level. +3 under sunny skies in Medicine Hat. 5 above in Lethbridge. 11 above for Vancouver, sunny, and 13 in Victoria. +4 with snow in Dease Lake and Fort Nelson. +1 and snow in Old Crow and Dawson. 2 above for Whitehorse. 6 above in Fort Liard and Trout Lake. -3 in Yellowknife. -8 for Sax Harbor with snow. 2 below and snow in Paulatuck. -11 in Cambridge Bay. 13 below for Whale Cove and Chesterfield. -19 in Clyde River and Igloolik. Welcome back. 33 families are facing an eviction notice in Prince Rupert, northern British Columbia. The majority of the tenants are Indigenous who will be struggling to find new homes due to low vacancy rates in northern towns. Residents are banding together in a fight to battle reno-victions. Lee Wilson reports.
Jadaflaga is from Haida Gwaii, but she's lived in Prince Rupert for over 10 years. She works 2 jobs. Her husband is an Indigenous artist. For the last decade, Flaga has lived in Pinecrest townhouses, but late February, there was a knock at the door. They were given an eviction notice.
What's going to happen? Where we're going to
A number company out of Vancouver had bought the townhouses in early February. Stephen Rodrosen and Avakai Sakar are the co-owners of 1232949 BC. Less than a month after they bought the townhouses, they sent eviction notices. 33 affordable family units in the area, with over 125 people, will be forced to start leaving at the end of June.
It's shocking, really shocking. Even now, after how long after we received it, we're still in shock. It's, quite the thing to absorb, especially when this is home for how many years? 10+ years.
Sylvia Hill is the daughter of Jadaflaga. She lives in a unit close to her mother's. Hill feels the stakes are high for her and her husband. They are expecting a baby around the same time they will lose their home.
By the end of this eviction date, I will only have 1 more week until my daughter is born. We are having a baby girl who I love with all my heart already. I feel little kicks, I feel little flutters. So that doesn't give us much room for error.
Josephine Alexi and her husband have lived in the townhouses for over a year. They have 2 children and multiple pets, which are considered part of their family. A 3-bedroom, pet-friendly place is rare. Prince Rupert is sitting at a less than 1% vacancy rate.
It feels like they're trying, the new owners are trying their best to kindly push us out, but it's also hard because where are we going to go?
Paul Legase is a poverty law advocate in Prince Rupert. He hosted meetings with some of the tenants and representatives from the city and BC government. They have been in negotiations with the owners who agreed to give $3,000 to each unit.
We were in negotiation with them and they agreed to do that 3-month monies up front. So we took a bit of back and forth and they agreed to it.
But even with $3,000, many families are still left with no place to go. They are trying to do more, and there's been progress with the negotiations.
We're in negotiations of staggering the evictions because putting 33 families on a market simultaneously with less than 1% is just, it's an absolute disaster.
Jennifer Rice is MLA for the North Coast of British Columbia. She's been part of the negotiations. The province is facing a housing crisis.
No secret that there's a housing issue throughout the entire province and in the Northwest. And we have issues in Kitimat that stem from the LNG project. And then we have the Port of Prince Rupert, which is rapidly growing and expanding.
Less than a month after being sold to new owners, the City of Prince Rupert issued 2 permits to 1232949 BC to renovate and evict. Sylvia Hill wonders why the city is allowing building owners to evict tenants for renovations and not building new homes.
Didn't they just build more buildings without displacing families? Why didn't they take that step 5-10 years ago? You know, in case something like this were to happen, or you know, in the case of a state of emergency, like how come they didn't have anything for us, anything for people like us? Because this isn't the first time it's happened in Prince Rupert, and it's definitely not going to be the last if they don't put a stop to it.
We have asked the city to comment on this story. They have refused. The province says they are aware reno-victions are a problem, and they've implemented a couple of policy changes to protect tenants, such as if major repairs aren't done to the units as claimed, owners would have to pay 12 months' rent to evicted tenants. Another protection is called the right of first refusal.
We have protections in place. It's called the right of first refusal. So the tenants that are being evicted right now have first dibs on the units once they're renovated.
The problem is there's no limit on how much the renovated unit can rent for. For so many tenants, they can't afford the higher renovated price. And many working middle-class families don't qualify for government subsidy programs.
We're not port workers. We don't make the big bucks. You know, we're stuck between a rock and a hard place because we're right in the middle. And I work 2 jobs. And it's difficult. It's difficult because there's next to nothing here in Prince Rupert.
We reached out to the building owners to comment on this story, but did not get a response. Jade Halaga is looking for a new place to live, but so far she hadn't found anything she could afford. She worries that other people will soon be in the same situation as her.
We have to set a precedent. We need our government to be involved as much as they say our local government says it's a provincial thing. We need more support for us here, not just lip service. We need our government to walk their talk and say what they're going to do.
Lee Wilson, APTN National News, Prince Rupert, British Columbia.
After being forced to cancel his first ever tour of Quebec, award-winning Wolastoqey musician Jeremy Dutcher took to Facebook live from his bedroom this afternoon to take song requests and answer questions from the hundreds of fans who checked in. That included an homage to Buffy Sainte-Marie, and that's what we will leave you with tonight. You can always stay up to date by visiting our website, aptnnews.ca. I'm Dennis Ward. Enjoy your weekend, and Jeremy singing us out.